Alberta Health Services. Healthy Albertans, healthy communities, together.
Thank you very much, and good afternoon, everyone. I'm Dr. Lyle Oberg, Chair of the Alberta Health Services Board, and I would like to welcome you to the AHS Public Board meeting. Thank you very much for taking the time to join us. This is a meeting of the board to consider 5 motions. We are participating today by teleconference. When I ask for a vote on the motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I will take that you are in favor of the motion. If there are none or a minority who either oppose or abstain, I will declare the motion carried. May I ask that someone move approval of the agenda that has been circulated? Angela, would you make that motion?
I'll make that motion, Mr. Chair.
Thank you, Angela. Will someone second the motion?
Sandy Edmonstone seconds the motion.
Thank you, Sandy. Is there any further discussion? Is anyone opposed or abstentions? The motion is carried. So based on the approved agenda, do any board members have a conflict of interest to declare at this time? Hearing none, we will move on. In the board materials that were minutes for the approval from the March 6, 2024 public board meeting, may I have someone move approval of the minutes?
It's Angela Fong. I'll make that motion.
Thank you, Angela. Will someone second the motion?
Sandy Edmonstone does so.
Thank you. Is there any further discussion? Any opposed or abstentions? The motion is carried and the minutes are approved. I would now ask Paul Haggis to present the first motion for approval.
Chairman, I move that the Alberta Health Services Board approve the 2024-25 Internal Audit and Enterprise Risk Management Portfolio Plan as reviewed by the Finance Audit Risk Committee and the Board, with such non-substantive changes that management of Alberta Health Services consider necessary or advised.
Thank you, Paul. Will someone second the motion?
Sandy Edmonstone will second that, Mr. Chair.
Thank you, Sandy. Any further discussion? Any opposed or abstentions? The motion is carried. I would now ask Paul to present the second motion for approval.
Chairman, I move that the Alberta Health Services Board approve the updated internal audit charter as reviewed by the Finance Audit and Risk Committee of the Board, with such non-substantive changes that management of Alberta Health Services consider necessary or advisable.
Thank you, Paul. Will someone second the motion? Sandy, will you second the motion?
Mr. Chair, I second the motion.
Thank you. Any further discussion? Any opposed or abstentions? The motion is carried. I would now ask Paul to present the third motion for approval.
Chair, I move that the Alberta Health Services Board, 1, approve the 2024-25 budget based on Alberta Health Services' current structure in the form reviewed by the Finance Audit Risk Committee, with such non-substantive changes the management of Alberta Health Services considered necessary or advisable. And 2, approve the following 2024-25 funding amounts for the 3 wholly owned subsidiaries of Alberta Health Services as provided in the 24-25 budget. A, 171 million of unrestricted base operating funding for capital care. B, 181 million of unrestricted base operating funding for Care West. And C, 900 million of unrestricted base operating funding for the Alberta Precision Laboratories Limited. And finally, 3, authorize and direct management of Alberta Health Services to deliver the 24-25 budget to the Minister of Health for approval.
Thank you, Paul. Will someone second the motion?
It's Angela Fong. I'll second the motion.
Thank you, Angela. Any further discussion? Any opposed or abstentions? The motion is carried. I would now ask Paul to present the fourth motion for approval.
Chairman, I move that the Alberta Health Services Board, 1, approve the 24-25 interim annual acute care funding to Covenant Health on the terms and conditions reviewed by the Finance Audit Risk Committee and the Board, with some non-substantive changes that management of Alberta Health Services considered necessary or advisable. And 2, delegate the authority to the Alberta Health Services President and Chief Executive Officer to execute and deliver the funding letter reflecting the above to Covenant Health in accordance with the delegation of authority and establishment of controls for commitments in policy 1100.
Thank you, Paul. Will someone second the motion?
Sandy Edmonstone seconds the motion.
Thank you, Sandy. Any further discussion? Any opposed or abstentions? The motion is carried. I would now ask Angela to present the fifth motion for approval.
Thank you, Mr. Chair. The Governance, Compliance and Human Resources Committee met on March 20th, 2024. I am presenting one motion for board approval today. The committee reviewed the Alberta Health Services accreditation status and activities for health facilities and programs annual report 2023. The board has reviewed the annual report and the members support the approval. Accordingly, I move that the Alberta Health Services Board approve the Alberta Health Services accreditation status and activities for health facilities and programs annual report 2023 as reviewed by the Governance, Compliance and Human Resources Committee and the board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. Support the Executive Chair delivering the report to the Minister of Health by March 31st, 2024, and direct management to make the report available on the Alberta Health Services public website as soon as practical.
Thank you, Angela. Will someone second the motion?
Sandy Edmonstone moves to second the motion.
Thank you, Sandy. Any further discussion? Any opposed or abstentions? The motion is carried. Board, we have now reached the end of our agenda. I now declare the business meeting adjourned. Thank you for joining us, and please be safe and well.
Together, we do amazing things every day.